What is evidence-based practice? Evidence-based practice, also known as EBP, improves patient care by combining scientific evidence with clinical expertise. An RN must be familiar and current with scientific clinical guidelines to meet constantly changing standards of care. After this lesson, you will have met course objectives 3, 4, 5, and 6, and lesson objectives: how to define EBP, how to identify barriers to implementing evidence-based practice. You will be able to describe the research process and articulate the role of the RN in research and research utilization. So, what is evidence-based practice? Evidence-based practice is related to integration of the best available evidence combined with clinical expertise, enabling health practitioners of all varieties to address healthcare questions with an evaluative and qualitative approach, and reflects clinical expertise that is integrated with the best scientific evidence, patient values and preferences, and clinical circumstances. Even though it may be difficult to initiate change based on scientific research, nurses should investigate and present research findings to their administrators and advocate for practices that promise improved patient outcomes. This is evidence-based practice. The overall aim of evidence-based practice is to standardize practice by maximizing good practice, reducing cost, and improving quality of care, to integrate the best available research and clinical expertise in the context of patient characteristics, culture, and patient preferences and values, and to use a problem-solving approach to nursing practice involving conscientious use of current best evidence in making decisions about patient care. So definitions include integration of individual clinical expertise with the best available external clinical evidence from systematic research. It's a process by which nurses make clinical decisions using the best available research evidence, their clinical expertise, and patient preferences. Now we're going to discuss defining attributes of evidence-based practice. Evidence-based practice consists of 3 key features: problem solving, evidence and theory integration, and patient values. So let's look at that a little bit more detailed. It has 3 unique key features. It's problem solving in its approach, which takes into account the clinical experience of the nurse. Clinical experience, nurse's ability to use clinical skills and past experience. It combines research evidence with knowledge and theory, and it allows for patient values to be expressed and incorporated in treatment regimens. So how are we going to put evidence-based practice to work? Evidence-based practice utilizes a 5-step process. Understanding evidence-based practice will help the nurse provide the patient with the best practices. So let's discuss these 5 fundamental steps. Step 1. Construct a relevant, answerable question from an identified clinical concern. Step 2. Search the literature for the best external evidence that addresses the clinical concern. Step 3. Critically appraise the evidence for validity and applicability. Step 4. Apply the evidence to your clinical concern. And step 5, evaluate your performance. Okay, so let's get started. Nurses need to know how to search resources for evidence-based practice, but first they must have developed a clear clinical question. The PICO method can be employed to guide the development of the question, and electronic resources can be useful when searching for best evidence. Studies should be evaluated for levels of evidence. Now we're going to go over these steps. So step 1, construct a relevant, answerable question from an identified clinical concern. Then you will have background questions. These seek general knowledge about a disease or condition. Or foreground questions. They ask for specific knowledge for clinical decisions and/or actions. Then remember we talked about the PICO method? This is P, patient or problem, I, intervention, C, comparison, or O, outcome. An example provided is in children with acute otitis media, should watchful waiting be considered instead of treatment with antibiotics? Then we have clinical question categories. Will influence this type of search strategies and resources that will be used. There are different types. We have diagnosis, therapy, harm or etiology, prognosis, prevention, and qualitative. Okay, remember we said step 2, you want to search the literature for the best external evidence. Track down the evidence. Evidence-based medicines review from Ovid, such as Medline, largest biomedical research literature database for general information. Then there is HealthStar. It focuses on health sciences, technology, administration, and clinical and non-clinical research. We have the Cochrane Library. This helps make informed healthcare decisions. We have the National Guideline Clearinghouse, which provides evidence-based clinical guidelines. Or you have the Agency for Healthcare Research and Quality, also known as AHRQ. It provides evidence, guidelines, and technology assessments on various clinical topics. Now we're going to take a look at step 3, to critically appraise the evidence. Evaluating the strength of a study. Studies are assigned a level of evidence based on quality, validity, and applicability. In level 1, an evidence represents the most valid reports addressing patient-oriented outcomes. A level 1 ranking also indicates that specific quality criteria were met based on the study type. A level 2 evidence addresses patient-oriented outcomes and uses some method of scientific investigation. Level 2 evidence implies an association rather than reliable evidence. Level 3 is evidence presents reports that are not based on scientific analysis of the patient-oriented outcomes. The strongest level, systematic review or meta-analysis of randomized controlled trials and evidence-based practice guidelines. Okay, so let's continue looking at step 3. The weakest level is an opinion from authorities and/or reports of expert committees. Critically appraising the evidence means to examine its validity, beginning with the overview. It requires knowledge of the research design and statistics. It involves looking at the reference list of the study. Special tools are there to help evaluate studies. There are 3 basic questions to ask. Is it worth looking at the results of this study, and can I trust the results? So is it reliable? Next question, what are the results? And then another question, are the results relevant for the patient? And then the questions to ask when performing a systemic critical appraisal is, was the review question clearly stated? Is it likely that relevant studies were missed? Was the criteria used to select articles for inclusion appropriate? Were the included studies sufficiently valid for the type of question asked? Were the results similar from study to study? And what are the results? Now let's review step 4, apply the evidence. The role of the RN is a critical link in bringing research-based changes into clinical practice. And step 5, to evaluate the performance. Knowledge that has its foundation in scientific study will assist the RN in making optimal clinical judgments as well as formulating a sound plan of care. Let's do a practice question. A nurse is using the PICO criteria to write a research question. In the research question, quote, in patients with congestive heart failure, will ACE inhibitors compared with beta blockers improve ejection fraction, end quote. Which section is the comparison? Is it the ACE inhibitors Is it the improved ejection fraction? Is it beta blockers? Or is it patients with congestive heart failure? Have you decided on an answer yet? 3. Beta blockers. PICO is an acronym used to describe a format of the 4 elements required to formulate a good clinical question. P for patient or problem, I for intervention, C for comparison, and O for outcomes. In this question, the beta blockers are the comparison with the ACE inhibitors. Evidence-based practice does encounter limitations. Quantitative studies have found several reasons for delays between research of evidence-based practice and application. So let's look at the evidence. Common barriers include accessibility because of limited access to and large amounts of research, which may be written in complex language or even a foreign language. So to recap, accessibility. The end user or nurse may have inadequate access to clinical research evidence and guidelines. Then we have the large volume of research to sift through. Then we have the research language, and then we have complex data and retrieval systems. What about the individual? Many times nurses are resistant to change and think that the old way is good enough. And how about the healthcare system? Bureaucratic structures, policies, and procedures take time to change. So let's look at that. Systematic barriers such as policies, procedures, and financial accountability. We also have to look at the physician idiosyncrasy versus discipline inquiry. We have the cost-benefit issues. We have the bureaucratic structures. And then we have to look at nursing. Nursing barriers to evidence-based practice come from a lack of time, lack of nurse researcher communication, lack of analytical skills, and lack of support from the healthcare organization. Advocating for change on committees and understanding how to apply research to practice are part of a nurse's job. We have issues such as split between education and services. That's where you get the lack of time. They have the lack of consensus about nursing responsibilities. They have lack of communication among nurses and researchers. There is lack of skills in locating, reading, and appraising nursing research data. And of course, the lack of organizational support, as previously discussed. Now let's review the apparent gaps in research utilization. Several theories exist about the gap between research and research utilization by nurses. These theories include lack of research availability, lack of research understanding, and lack of nursing authority, and lack of time and energy. Not all nurses must conceive of and conduct new research. However, all nurses need the ability and the empowerment to institute change appropriately based on research findings. RNs must base specific interventions and all aspects of the nursing process on scientific research. And of course, you have barriers such as lack of knowledge of the availability of research applicable to nursing practice, lack of educational preparedness to understand research, lack of time, nurses are pressed for time, lack of authority to institute changes based on research, no forum for research-based practice change proposals, or no clear method of launching a trial study. So let's review research, both simple and necessary. Quality assurance and performance improvement studies are a vital part of achieving quality care. So basically, the simplest research for the RN is quality assurance or performance improvement studies. They use data to determine whether patient outcome criteria are being met, charting is complete, or procedures are being done per protocol. The result of these studies is to assist the staff in achieving consistently excellent quality care. So let's review some of the components and process in a research study. First off, concepts. All research begins with a concept on which a study will base its action and center its focus. Basic research is refining concepts and abstract ideas taken from an observed behavior or characteristic to make it usable or applicable. Research attempts to define a concept in terms of common behaviors. Then we have variables. There are several types of variables that affect research studies. Active variables are those manipulated by the researcher, while attribute variables are pre-existing and out of the researcher's control. So let's review concept, idea, or attribute that is captured and defined within a research study. It's so named because it varies from subject to subject. Researcher attempts to control the variables, statistically account for them, or explain them in relation to what is being studied. We have the active variable, and that's the researcher manipulates an active variable in an attempt to determine whether this will have the desired effect on the outcome. And then we have the attribute variable, and the researcher has no control over an attribute variable. Continuing to look at variables, independent variables are causative factors. Independent variables are those being influenced for a valid, useful study. Variables must be tightly defined and reproducible. Independent variable or variable that influences a presumed effect. And dependent variable is that it is influenced. So the purpose of the research study is to determine the apparent relationship between the independent variable and the dependent variable. So defining variables, must define variables in a research study. We have operational definition, which specifies the operations associated with collecting the data on that variable or how the researcher will measure the variable. Then we have literature search. Before beginning or defining a study, the researcher must identify past research that could be used to support guidance or clarification. This is done to determine whether prior research has been done. It can identify past research related to the study. It can assist in defining the variables, formulating a hypothesis, establishing tools that may be needed to collect data and clarify the problem, and may define the theory or identify additional variables that may need to be considered or controlled. It also suggests areas that are not as well supported by research, and it serves to support the findings. So let's look at practice question number 2, components and process in a research. A nurse is testing 2 types of wound care for patients of all ages, genders, and diagnosis. The wound care would be randomly used on different patients, one group receiving one type and another group receiving the second type. What is the active variable in this study? Is it 1, gender, 2, diagnosis, 3, age, or 4, wound care? Have you decided on an answer yet? It is 4, wound care. The researcher is attempting to manipulate an active variable in an attempt to determine whether this will have the desired effect on the outcome. This active variable in this case is the wound care. Okay, now we're going to talk about the research process. You can refer to your textbook FYI 13-1 for the steps in the research process. First is making predictions. Researchers begin with the hypothesis that is based on empirical data that suggest a relationship among variables. The hypothesis is written prediction made by the researcher with regard to the variables. It directs the research by setting limits to the study because the researcher will try to prove or disprove the prediction. For an example, menopausal women who include 40 milligrams of isolated soy protein in their daily diets report fewer hot flashes and more uninterrupted sleep than those whose diet contains no isolated soy protein. And then, of course, there's empirical data, which is objective evidence. Next step, to define the research study. A research study can be experimental, like random introduction to an intervention, or it can be non-experimental, such as observation without intervention, or it could be quasi-experimental, which is a non-random introduction to an intervention. Research design includes experimental design, which controls the variables and randomly assigns the subjects to study groups. The quasi-experimental design, the researcher does not attempt to randomize the subjects, but does attempt to show a relationship between the dependent and independent variables. Then we need to define the population. Researchers attempt to define a population of a study in a way that reduces the possibilities of unknown influences. Population chosen is one that will potentially benefit from the study results. Now we're going to select a sample. The sample selection must be realistic and yet representative of the general population. Depending on the focus of the study, the sample size may be small and yet still representative of the population in question. Sample selection. Choosing a representational model of the entire population on which data can be easily or realistically collected. Sample size is the number of study participants. The next step is making a data collection plan. A data collection plan is necessary to determine what is needed to begin the study and how the study will be conducted. Most studies have both quantitative, which is statistical and controlled, and qualitative parts, which is subjective. Quantitative studies ask the questions who, what, why, where, when, or how, and describes the relationship among variables. Qualitative study attempts to clarify underlying assumptions that are vague or unclear by asking what the perceptions, beliefs, or tenets are within a particular setting. You may conduct a pilot study before implementing the actual study. Next step is checking reliability and validity. Reliability determines the accuracy of the data collection technique and the possibility of an influence that could skew the data. Validity is the degree to which the data collection technique is used correctly. Criteria used to test whether instruments, tools, machines, and research designs will give accurate results. Reliability measures the device or technique or the instrument used to collect data by asking how trustworthy it is at gathering the intended data. Validity measures the degree to which an instrument is measuring what it is supposed to measure. Let's look at collecting data. Data collection must be preceded by approval by the Research Review Committee, creation of a patient consent forms, and consideration of any ethical and legal issues. Methods must be approved before implementing. Patient consent is needed, and you need to consider legal and ethical issues. Then it leads us to interpreting the results. Results consider data analysis, identified limitations, and hypothesis support. Other research questions spawning new studies are often generated by study outcomes. This requires providing information on how the data was analyzed, what limitations were identified, and how the results support the hypothesis. It's a formal statistical analysis that is used. And finally, now we will communicate the results. Published results may or may not clearly communicate applicability to nursing practices. This is the final step. Research summaries may be submitted for publication. This includes a section that demonstrates how the research will apply to nursing. Now let's take a look at research utilization. Scientific research should be incorporated into the creation of policy and procedures that affect patient care. The RN should base decisions on proven research methods and not on assumptions or traditions. So basically, validating research results requires that the nurse understand research terminology and compare outcomes from one study to another. Then, of course, we're going to apply research to practice. Research can be applied three ways: through direct utilization or actively changing practice based on research results, indirect utilization or gaining knowledge to increase critical thinking abilities, and persuasive utilization or using research outcomes to change policy and procedures to meet practice standards. Identifying areas for research. Research improves patient care. Questions prompted by clinical observations can often be the foundation of a new nursing research study. So look, objective evidence from clinical observations gathered from patient care experiences can spur research questions. Staff RNs may take part in the study through data gathering or testing new procedures or products. Encouraging all nurses to bring research into their daily practice will ultimately help improve patient care. This concludes this lesson.